All right, now we're going to talk about how to apply an occlusive dressing for a chest injury. We'll be using our wound torso here to demonstrate this, and we're specifically this penetrating injury to the chest wall right here. Most chest injuries don't bleed a ton. If you do see bleeding, you can put pressure over that wound, but it's not as necessary as if it's massively bleeding. You want to take your chest seal, open it. This chest seal comes with 2 chest seals. That is one for this wound, and then one for the likely second wound that exists on the back of the patient. So don't forget to check the back. So you're going to unfold the chest seal. So this chest seal is vented. There's a one-way vent in the center. You can use a vented or unvented chest seal. If you're using a vented chest seal, you want to place the vent as close to over the wound as you can, and then make sure all the edges are completely adhered and there's no gap where air can escape other than through that one-way valve. There's situations where this vent can clog, or if you don't have a vent, air can still build up in the chest cavity, which can cause the patient increasing difficulty breathing. You just simply take the edge of it, open it up for a second, let them take a few breaths, and then put it right back in place. That should relieve the pressure inside the chest and allow them to breathe easier. Question that's very common is why we wouldn't pack a hole in the chest like we would pack a hole in the arm or the leg. It's a very good question. The reason is because your lungs that take up this whole area of the chest, there's a whole lot of room in there, and you should not go sticking anything into the chest itself, because you can create a lot of problems down the road for the patient that is real hard for them to survive if you do. And there's so much area, it'll take so much gauze to pack that area, and you won't ever actually get to the source of the bleeding, because the bleeding is either inside the lung cavity or behind the ribs itself. So do not ever put anything into a chest wound, just simply cover it with what's called an occlusive dressing. And occlusive meaning air just can't get through it. After you apply the chest seal on the wound you can see, you want to be very sure to look under the patient's armpits on the side of their chest, and then also roll them and look on the back of the patient to make sure there's not another hole that you also need to put an occlusive dressing on. From there, just monitor your patient's breathing, burp the chest seal if you have to, if the breathing gets harder and harder, and wait for EMS to arrive.